disorders, studying anxiety disorders, studying anger management, stress management, and stigma associated with mental illness.
Yes, ma'am. When did you complete your graduate education?
Well, I'm a licensed clinical psychologist. I attended the University of Southern Mississippi, and I earned a PhD in psychology.
Okay. What was the topic of your dissertation?
That's a long time ago. The assessment of memory in individuals ages 65 to 75.
Can you tell me like the process of going about doing your research for your dissertation or getting your graduate degree?
Well, the steps for planning your dissertation are as follows. You start with reading lots and lots and lots of articles. It's advisable that research be based on filling gaps in the literature. So you have to read the literature. And particularly in articles where they have sections in the discussion part where they identify limitations for the existing study, then one should examine that very closely because that clearly highlights the need for further work to be done. And the ideas oftentimes are generated from existing research in terms of what needs to be done. The next step is to put together a proposal, securing appropriate instruments and measurements, formulating the research questions. What is it that you want to answer from the data that you collect? Also in that proposal, you have to identify what kind of data analysis you plan to utilize.
Well, what type of research did you conduct, qualitative or quantitative?
My research has always been quantitative.
Why is that?
Well, actually, quantitative research, in my opinion, typically requires more scientific rigor. There's more uniformity and standardization. There is opportunities for statistical analysis, which is part of the scientific rigor. Many journals publish quantitative research. They are now more qualitative research journals, but they are significantly fewer compared to quantitative research journals.
How important do you think it is for undergrads to complete a course in research methods? Like, basically, how important do you think research is for students?
Oh, I think it's extremely important if you don't become a researcher, reading about research formulates the basis for your knowledge. So what's been reported by experts, people who've devoted years and years and years of their professional careers to presenting research and publishing research, those readings are invaluable to the undergraduate student. And two, it's a very good vocation, so some undergraduate students may decide to follow a research career.
Are you working on any research now?
This very minute?
Well, just recently.
Recently, I've done work collecting data and analyzing data and presenting it on stigma in both a community sample and an undergraduate college student sample, where we gave a stigma inventory. We also asked questions about barriers to seeking mental health services. that was my dissertation years ago.
Oh, okay.
My research interests are anxiety disorders, stress management, anger management, stigma reduction, toward mental illness.
Like, what are some of the benefits that you think you have gotten out of researching that field?
Benefits to me personally?
Well, to the community.
Well, I think that the many presentations I do tend to enlighten and educate people, so that, for example, with stigma, the more we talk about it, the more we inform people, the greater the chance is that we may be able to help reduce stigma associated with mental illness. It's beneficial that someone is at least addressing that issue, because it goes neglected or has gone neglected, and therefore people suffer from mental illness and suffer in silence because of the stigma. So it has a humanitarian benefit, and so that brings me great satisfaction.
Yes, ma'am. Do your research involve you dealing with like live patients, like with using humans as subjects?
Yes, it does.
How do you go about to working with a human subject?
Well, according to the IRB, which is the Institutional Review Board, all researchers must first take an online course to get certified to conduct research involving human subjects. And then you submit an IRB application to get that, to get permission to conduct research with human subjects.
Do you have to get like some type of consent form when working with it?
Yes, and the IRB must approve your informed consent form, and it has to meet certain criteria. There's certain paragraphs and statements that are mandatory before that informed consent statement can be approved.
Okay. How is it? Like when you work with the human, what's like some of the biggest obstacles that you had to overcome, basically, or you face dealing with maybe a mental health patient?
Probably the obstacle of not completing all the questions. Perhaps the questions may trigger some unpleasant memories or cause some distress. But we manage that. We always have a remedy for that, because we call it debriefing, as well as referring people on to seek counseling if indeed they are troubled as a result of completing any of our surveys. But completing all of the questions, agreeing to participate. People have the right to refuse to participate, and have the right to refuse to cease participating. And since they have that right, sometimes you don't have the sample size that you desire. If too many of your clients, too many of your research participants decline participating or do not complete the full instrument.
Oh, okay. My research is on how the media how their images hurts the overall outcome of the military. Like, for example, when you look on the news, you see images of war, of soldiers overseas. Well, sometimes it's not. People don't understand that you can't always display everything over there, because, like during the Vietnam War, when people saw those images, they had a negative impact on the military. So my question is, do you work with a lot of military? I know you say you have your patients have been military.
Here in our clinic, we've seen very few vets. Very few. On the other hand, mental health services being provided to veterans has increased because of all of the wars. So the VA system revitalize the psychological service because they had no choice. They're having too many soldiers who are in need of mental health services.
Because I know, basically, when we get back from another country, sometimes we don't always have the access to particular clinics or whatever the case may be. Because I know a lot of veterans, they either mentally dealing with all that shell shock, they rattle in the brain. I know a friend right now said he's going through so much, he's basically in shell shock because he's been in 2 or 3 wars.
Oh, in fact, that's another area that I have studied, at least through some of my graduate students, post-traumatic stress disorder. Yeah. So a number of veterans sometimes experience post-traumatic stress disorder, having been engaged in combat, and a number are coming home and in need of support, a listening ear, assistance in managing this disorder that they've developed as a result of being in the military.
Do you like your mental health? Have you ever seen somebody that could come back from a mental disorder?
Oh, yeah. When you say come back, you mean
like
recover?
Get back to normal?
Oh, yes. That's the good news. That's why we like people to come in. The majority of the disorders are treatable. Oh, not necessarily curable, but treatable. So with treatment, people have a much greater, a much improved prognosis for returning to a previous state of functioning.
Okay. Do a lot of them get like medicine, or y'all just?
Well, as a psychologist, I do all talk therapy.
All talk therapy.
Yeah, and particularly I practice cognitive behavior therapy. It is an empirically supported psychotherapy. Speaking of research, it's been studied to be effective with a number of disorders, and there's a protocol, there's a way to approach various disorders using cognitive behavior therapy. So I'm very optimistic that if we could just get people to come in and get help and work. Now, it's not easy once people get into therapy, but my mantra is need help, get help, because it's a win situation. The person can, if they get help, they can resume a previous state of functioning.
Okay. This is my last question. Any suggestions for any other future researchers, like something that can help them?
Well, yes. Number 1, read, and engage in critical thinking. Think. Work on writing skills and oral expression skills. If I had to do it all over again, I certainly would try to have more publications. Yeah. In professional journals, referee journals, where my research will be published as a journal article.
Oh, okay.
And I think I really do think the undergraduate students should set that as their goals. It's not easy to do, but work in laboratories on projects